I, Dr. Sudeshna Ray, I'm going to talk about the most frequently asked questions that you might have as a newly married couple or as a couple who's going to get married soon. How do I manage my period dates if they are expected to fall around my marriage or honeymoon dates? So, it's a good idea to see your gynecologist about 2 weeks prior to the expected period, or better even if it is 1 month or 2 months prior to your marriage date or expected date of your periods. This is a good time to discuss how do we manage the dates around the marriage or the honeymoon dates or the important days of the event. Mostly they are done with hormonal pills that can be taken for 21 days or 5 days. They do come with a good fair amount of side effects like bloating, heavy-headedness, breast pain. So please be well informed and please be prepared. Am I going to get a lot of pain while having sex for the first time? The answer is unlikely. Unlikely to have a lot of pain. It's perfectly okay to have a little bit of discomfort while positioning, while penetration, but it doesn't take more than a few attempts to get it all right. Things are far easier if you are both comfortable with each other psychologically and emotionally. And of course, the couple needs to drop off a lot of inhibitions and explore each other's bodies physically well before the penetrative sex. What happens if I do not bleed the first time I have sex? Would I be considered as a non-virgin or suspected to be a non-virgin? Well, dear woman, your chastity doesn't lie in your hymen, for God's sake. Hymen is just a thin curtain of tissue, a very thin curtain of tissue at the mouth of the vagina, and which can be very easily torn with activities like swimming, cycling, playing high-intensity sports, athletics, etc. Most often, with an active lifestyle that you have as a teenager or as a young adult, it's more likely that you will not have any bleeding during the first time you have penetrative sex. Most women are not even born with the hymen. How do I know that my husband does not have an infection? The answer is by being open and honest in the relationship. Of course, there are some tests to find out whether there is any sexually transmitted infection or not, but often the old infections might not be evident, or the newer infections will take some time to be picked up. If there is anything like an ulcer, like a crack, or a lump in the penis, it's a good idea to see an andrologist, and till the time that he sees an andrologist, it's a good idea to use condoms while having penetrative sex. How do I ensure my personal hygiene while having frequent sex? 1. Empty your bladder or the water bag before and after sex. It's a good idea to ask your partner to clean the organ well before going in. It's also a good idea to wash yourself after sex, to clean yourself with a gentle water wash. Even if you have slept off without cleaning, it's perfectly okay. You can clean it after you get up. Urinary tract infections are common after sex, especially when you're beginning as a couple for penetrative sex. So you speak to your gynecologist and get the tips to avoid such infections, and drink a lot of water to maintain adequate hydration and to maintain a cleaning from inside. What happens if I cannot have penetrative sex in my first night or the first few nights? Is there something wrong with me? The answer is most likely not. As I said, that it just gets easier with time and with more comfort and emotional bonding in the relationship. However, if you are still having a problem, you can see your gynecologist to rule out some vaginal muscle spasm or a blocked vagina. But please remember that these are very rare findings. Most women will have a completely normal anatomy, and you don't need to have any proactive tests to find out whether you have a normal anatomy or not. Sometimes even your partner might have a difficulty in erection, or he might have a bent penis, or he might have a premature ejaculation, for which he needs to see an andrologist before a successful penetrative sex. What are the measures that I can take to avoid a pregnancy? So this is a good idea to talk to your gynecologist even before marriage or soon after marriage about all the birth control methods or contraception as we call them. It can be a natural method like a calendar method or a withdrawal method. It can be a barrier method like a condom, male and female, or female diaphragm, cervical cups, etc. It can also be in form of hormonal, pills or rings or patches. So it's a good idea to talk about it and to take an informed decision about what suits you the best instead of just having a misconception around it. What if I want to get pregnant soon after my marriage? The answer is don't use contraception, don't use any birth control methods. Understand the best days to get pregnant and start your prenatal vitamins. But I would advise against any testing to gauge the fertility potential as a couple. Because unless and until you have really tried for the minimum period of time as a couple to have a baby, some tests might unnecessarily worry you. So it's a good idea to go for the tests only when it's absolutely needed. You can refer to my video on best days to get pregnant for further information. Will my body undergo certain changes with regular sexual activity? The answer is yes, it can be if you're not used to frequent sex before your marriage. So the changes that happens is mostly in form of a little bit of a fat deposition around the hips and the waistline. This usually happens because of certain hormonal changes that happens with regular sexual activity. You can have sex as many times as you want to or as comfortable as you are. These changes usually settle down with time. Can I have sex during my periods? The answer is yes, you might, because as some couples do prefer having sex during the periods, 1, because there are lesser chance of pregnancy, 2, because the woman feels that there are less menstrual cramps, and 3, because there is a natural lubrication. However, even if you don't mind the mess, there is a risk of infection and certain long-term diseases like endometriosis. All these things are best discussed before you want to get married or before one plans to live together. It's always better to get prepared with the right information. To contact me, please write at drsudeshnacares@gmail.com. Thank you.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.